You call me patient because patience is what's expected of me. Living with chronic pain, my whole life is a waiting room. 1 year to see a specialist who is 6 hours behind schedule for our 5-minute consultation. 3 months for a CT scan at a clinic advertising same-day private scans for $2,000. 46 hours in Emerge, begging for x-rays, only to be told I am a waste of resources by the resident. 3 years scrolling through online forums, reading horror stories of botched medical appliances, waiting for updates in treatment available in the US to drop in Canada like the next iPhone. Watching my doctors compete for clients on TikTok, blurring the lines between care and business with targeted ads. Paying $300, $500, $700 for consultations because non-essential medical professions lobbied to be kept out of public health care. Fearing their profits would drop when it's my friends dropping dead. The same year the government makes cuts to health care, they legalize medically assisted death. Now my friends have MAID on speed dial. But don't mention suicidality, or you will be an inpatient involuntarily. In the care roulette, will I be a casualty or a case study? Ask the doctor who said I'll look like an ape if he chooses to operate on me. Try keeping a job when medical appointments are during business hours. Try working when disability payments stop when I start making more than a doctor's single-day wage. Try affording treatment if disability checks are less than rent. Try choosing between marrying your cross-border love or keeping your benefits under your parents' care. People my age are saving for weddings, mortgages. I'm saving for surgery. No matter how baggy my clothes or bound my chest, the doctor won't ask my pronouns before diagnosing me woman. No cause besides a life of shrinking myself into shadow. No cure besides finding a good man to take care of a sick girl. My cane gives me more support than any doctor or man ever has. The same faces that colonized my country make promises in their white coats. They are here to help me, while the ones from my country won't take me seriously unless my father is in the room. Canadian doctors spend 20 hours total studying pain. I spend my entire 20s studying how to talk to doctors about pain. Doctors complain my pain is non-specific. So I come to appointments covered in Sharpie, body like an operation board game. They call me pushy. Print my symptoms list, a 10-page elegy. They may glance, but won't wear their glasses, call me over-prepared. Have you forgotten who is the specialist on your body? Prescribe me anxiety. Tell my story like I'm reading my own eulogy. Watch Doc's eyebrows raise, lips downturn. Have you considered therapy? What a difficult girl. What a strange case. You're too young to be in pain. I can't even tell you to lose weight. Take some Tylenol, try some yoga, try smiling. Got the neurologist scratching his head, the rheumatologist pointing fingers, the neuro-ophthalmologist telling me don't trust the vision therapist, the dentist sending me to a postural specialist, the chiropractor warning me against surgery as a last resort. But it's too late. I've been butchered by the knife that sliced the body into parts to be studied. Do you know your own history, doctor? Gynecology, fathered by the torture of enslaved Black women. Radiology, testing on Indigenous people nefariously. Immunology, starving children in residential schools to death. psychology, forcing electroshock therapy funded by the CIA, obstetricians, sterilizing migrants to ensure white supremacy, using social workers and nurses as your clergy, and your holy trinity of diagnosis, treatment, cure, the panopticonic institution regulating the sick and disabled. I take on the burden of your broken and barriered and so-called benevolent system just doing its best. I am called patient because patience is what is expected of me. Are you feeling dysregulated, doctor? Your hands feeling tied? Shifting in your blame-thrown thinking? Not me. Who was your last difficult patient? Did you take it personally? Did you lose your patience? Good. Now we have something in common.